the Anti-Kickback Law, the Stark Law, and the gifts to beneficiaries, those specifically can land you in jail if you're not following them. And so, like, agencies really need to make sure that they're aware, understand these regulations, train all of their marketing employees to understand all of these rules, and make sure and have some kind of compliance program in check to make sure that they're being followed. Hi, this is Mariam Treystman from the Home Health Consultant, and today we're going to be discussing the core laws around marketing for your home health or hospice agency. Like and subscribe to our channel for more expert insights in the home health and hospice industry. So first, we're going to be covering the basic rules and regulations that you should be aware of prior to starting your marketing program. These include the Medicare Anti-Kickback Statute, Ethics in Patient Referrals Act, also known as the Stark Law, the Beneficiary Inducement Law, or gifts to beneficiaries, and conflict of interest policies from ACHC. The Anti-Kickback Statute is a federal law that prohibits the exchange of anything of value to induce or reward patient referrals for Medicare or other federally funded programs. The AKS applies to both the person who offers or pays the kickback and the person who receives it. So, long story short, the Anti-Kickback Statute doesn't allow you to pay for the referrals. Whether that's paying the doctor or whoever is referring to try to push the product or service, or just straight up paying per referral. Essentially, there shouldn't be any kind of financial relationship that creates an incentive to refer for the patient. The next law that agencies should be familiar with is called the Stark Law. The Stark Law is a set of federal laws in the United States that prohibit physicians from referring patients to certain health services if they have a financial relationship with the entity providing those services. The law is also known as the Physician Self-Referral Law. So what does the Stark Law prohibit? 1, it prohibits physicians from referring Medicare and Medicaid patients to entities with which they have a financial relationship. 2, it prohibits entities from filing claims for improperly referred services. 3, it prohibits physicians from seeking personal financial gain related to patient care. And 4, it prohibits physicians from performing unnecessary or fraudulent testing, referrals, or medical services. So a lot of these laws that agencies should be aware of are pretty similar sounding, but it's important to understand the differences. The Stark Law is talking about physicians referring to companies that they have a financial relationship with. This is different than anti-kickback, where the physician doesn't have a financial relationship with the agency outside of a pay-for-referral kind of arrangement. And so if they receive a referral, they get. If the agency receives a referral, they pay the referrer or whatever. That is against the law, according to the Anti-Kickback Statute. The Stark laws prohibit a physician to refer to a company that they are employed by. For example, if a physician works in a dialysis center, they can't then in their private practice refer agencies to or patients to the dialysis center. So it's more about sending themselves work to enrich themselves. Now, when all of these laws talk about physicians referring, really this applies to any referrers. This could be discharge planners in hospitals, or whoever else that could be a referral source for a home health or hospice agency. The next law agencies should be aware of is the Beneficiary Inducement Law, or gifts to beneficiaries. CMS allows some entities to give nominal gifts to Medicare and Medicaid beneficiaries. These gifts must be $15 or less per item and no more than $75 per person per year. So what are nominal gifts? Nominal gifts are items worth $15 or less based on the retail price. So, you can gift your patient like a calculator or like a cheap pen. Cash and cash equivalents are not permitted. You can't give them $10 every time you see them. Gifts can be offered for marketing purposes regardless of enrollment status. But again, they need to be under $15 per person and no more than $75 per year. So why are nominal gifts allowed? It's because CMS believes that strengthening beneficiary engagement can help improve the healthcare system. And just as a basic example, clinicians, they see patients pretty regularly. If a nurse is seeing a patient 2-3 times a week or even once a week for some period of time, and then the holidays come up, it's okay to give them like a little Starbucks or something like that, or a little like cute little chocolate set, or I don't know, whatever. That's okay, and it allows for genuine human interaction, which is an important part of healthcare. So much of healthcare is about compassion and caring for other people, and so this allows for those kinds of sentiments without stepping into kickbacks and gifts to beneficiaries and things like that. And so if you do want to give gifts to your patients for whatever reason, on their birthday or whatever, just make sure that it's they don't cost more than $15 per item. Of course, we understand that because of inflation, that's getting harder and harder, but that is the current law that Medicare expects. The final set of rules to be aware of prior to starting your marketing program are conflict of interest policies. ACHC has a standard that requires that policies and procedures define conflicts of interest and the procedure for disclosure in conduct and relationships with personnel, customers, and patients. In the event of proceedings that require input, voting, or decisions, the individuals with a conflict of interest are excluded from the activity. What this means: if a member of the agency, an employee, or an owner, or anybody with a financial relationship has a conflict of interest with a referrer, this must be disclosed in writing prior to the start of employment. This doesn't exclude them from working in or with the agency. However, anytime a situation arises where their input is needed, that person is no longer allowed to be involved in the decisions or conversations around the situation. If the relationship is so close to the referrer that it's essentially a self-referral, this does not then get covered by conflict of interest policies. Essentially, agencies need to use their best judgment when considering if someone's relationship with a referral source is more on the side of a self-referral for a physician if they're referring there, or if it's more falling under conflict of interest policies. I'll give you a really good example of something that is right on the line of this and could go either way. If you have a physician who refers to the agency that you are employed by as a direct family member, so like sibling, parent, child, this can go either way depending on the number of referrals and like what the agency's relationship is and so on. But if you're ever in a situation where you have to justify this relationship or this interaction, it may not go well. And so agencies really need to use their best judgment about these things. Now, if the physician is the spouse of an owner of a company or is the spouse of, somebody working in the company, that might not be too favorably looked upon, because at that point it's almost a self-referral. So as you can see, there's a lot of gray area between these laws and kind of real world situations. And so agencies really need to tread lightly when establishing marketing relationships and practices, and really, really make sure that you are not crossing any of these issues. The penalty for not following the laws, I'm not even talking about the conflict of interest statute. I mean, that's important and needs to be minded and followed and so on. But the Anti-Kickback Law, the Stark Law, and the gifts to beneficiaries, those specifically can land you in jail if you're not following them. And so agencies really need to make sure that they're aware, understand these regulations, train all of their marketing employees to understand all of these rules, and make sure and have some kind of compliance program in check to make sure that they're being followed. Thank you for joining us as we discuss the core laws and regulations around marketing for your home health or hospice agency. Remember, compliance is the foundation of long-term success in this industry. And if you found this video helpful, please like, subscribe, and share it with others who might find benefit. Thank you.